Our top focus right now is the centre, which has tightened rules governing the sale of cough syrups, including other types of syrups as well, with a fresh amendment to the Drugs Rules 1945 that will require consumers to now obtain a doctor's prescription before purchasing such medicines from pharmacies. The move comes months after contaminated cough syrups were linked to the death of children in Madhya Pradesh and Rajasthan, raising fresh concerns over the safety and regulation of commonly used liquid medicines. The incidents renewed calls for tighter oversight and stricter checks on the manufacture and sale of syrup formulations. The Ministry of Health and Family Welfare notified the modification made to the Drug Rules 2026, which removed the word syrups from the Schedule K of the Drug Rules 1945, which earlier sat under item number 7. Schedule K exempts some medicines like antiseptics, contraceptives and others from specific provisions that govern the manufacturing and sale of drugs under the Drugs and Cosmetics Act. Removing syrups from the list will not only allow people to buy them over the not allow people, to buy them over the counter without a prescription from a licensed physician, but will in a way also ensure that self-medication is under control. Dr. Ishwar Gilada, health expert with us on the broadcast. Dr. Gilada, how critical is this notification by the centre vis-a-vis the cough syrups? We've now seen multiple cases of cough syrup deaths that have taken place in India. How do you think this particular move is really going to help contain this crisis? Dr. Gilada, can you hear me?
Yes, tell me.
Yes, Dr. Gilada, we've just learned of an important notification by the centre vis-a-vis the sale of syrups in pharmacies, including cough syrups. How critical do you think this move is to contain a crisis wherein we've seen multiple deaths in our country due to the sale of, bad cough syrups to children?
Thank you very much, Devika, for having me on this show. There is a saying in Hindi, "Der se aaye durust aaye." So it has been really delayed notification. But anyway, we welcome such notification because among large countries, India is probably only country where you can get any medicine without prescription at any chemist shop. So there is no regulation, which there are regulations on paper, but you go and buy go to the chemist shop, just narrate some medicine, you get it. You show any prescription, you get it. You show prescription of any pathy doctor, whether it is a Ayurveda Acharya or homeopath, you get allopathy medicine. You show a old prescription of 5 or 10-year-old, you get medicine. So I think under this situation, people going on the chemist shop and buying something off the across the counter, that is bad. Because among cough syrup, there are different type of cough syrup which people do not understand. Even a chemist shop may not understand, because there are two basic kind of variety or category. One is to expectorant, like if something is stuck inside, you take a cough syrup to expectorant out and spit it. The second is called antitussive, which is kind of a dry cough. You take a syrup to suppress that kind of cough reflex, and there can be allergy where it is anti-allergic cough syrup. So there are different type of cough syrup. Person will go to the counter, say that I have cough, give me cough syrup. He will give or she will give any cough syrup. The person will take anything. Secondly, cough syrups also have some kind of chemicals and even codeine and alcohol. And that is a habit forming. I have seen people who are popping up the cough syrup like any kind of a drink. And they do not even measure with a spoon, or they provide a container to see 2.5 ml or 5 ml. They take a cup syrup and take just like that. Maybe half a bottle, maybe sometimes full bottle, and they get habituated to that. So I think it's a very good notification. On one hand, there will be some prescription practice, but on the other hand, there will be also some kind of restriction on sale of cough syrup, from where they are procuring, how they are distributing. So all these things will be taken care of.
Absolutely. But at the same time, Dr. Gilada, how exactly do you think now pharmacies and others will ensure that these rules are actually implemented? Because we do see that there is sometimes, a little bit of a miss between some of the notifications that come out, some of the rules that come out, and actual implementation on the ground?
You are perfectly there to nail the coffin, because notifications are one thing, that's the first stage of kind of regulation. But the next stage is implementation, and where we are poor. I always call, we have a diarrhea of thoughts and constipation of implementation. Secondly, at Government of India level, there are two different departments. Where one is called DCGI, Drug Controller General of India, which is looking after only drug, and FCI, which looks after food. But at state level, there's a Food and Drug Department, which is called FDA. That means, depending on the season, the officers will be moving from one to other sector. For example, during the Diwali season, when they are expecting there will be some kind of adulteration in milk and khoa or kind of paneer, then there will be more people which will be posted to look at food adulteration. So there will be nobody to look after the drug department. And same thing would happen. Secondly, there's a perennial shortage of staff at FDA. For example, giving the example of Maharashtra state, there has been one publication to show that currently with the given strain, the 60% people are not there, only 40% are appointed. However, if we look at the workload and how many officers should be there, then only 10% of the officers are there. So that means there is a perennial shortage of staff. Then there is a FDA, which is together Food and Drug Administration, and that is actually a kind of a problem of implementation. And therefore, the Government of India should look after, because most of the states are run by them now, their party. They should implement what is in the central government. Same thing should happen at the state government. There should be food department different and drug department different.
Right, absolutely. So thank you so much for joining us on the broadcast with that perspective. Important update there for all consumers. Meanwhile, in other news coming in, special arrangements have been put in place for the secure transport of the NEET re-examination